Hello and welcome everyone. It is 11:30 Central, so we will get started. Thank you for tuning in to today's webinar, Creating a Wearable Geriatric Simulation Program, Walking in the Shoes of an Aging Individual. My name is Kelsey and I will be your moderator today. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare baby infant simulator, who then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for tools like our bovine birthing and ultrasound, virtual reality welding simulator, and wearable geriatric sensitivity suits. If you have some time, we encourage you to check out our website and see it all. Co-presenting today, we have Denise Dubois, who is the Senior Family and Consumer Sciences Product Manager here at Realityworks and has been with us for over 15 years. Denise has experience teaching in Wisconsin and Minnesota and has over 20 years of education, marketing experience, and professional development. She's also the co-chair for the Alliance for Family and Consumer Sciences and on the Executive Council National Consortium for the Health Science Education. We also have Molly Kellgren presenting. Molly is the Health Science Product Manager here at Realityworks and has been with us for over 2 years. She's a PhD prepared registered nurse with specialized skills in education and the use of simulation as teaching and learning strategy. She has an in-depth background of health science and simulation, and she is a great resource for today's presentation. Before we get started, I want to cover a couple things. First, today's presentation is being recorded, and all attendees will receive a link containing the recording as well as a copy of the PowerPoint slides and free resources. For those of you attending live today, you also receive a certificate of completion for attending today's presentation. Keep an eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A, so feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I will go ahead and pass things over to Denise and Molly.
Great. Thank you, Kelsey. My name is Molly Kellgren, as Kelsey mentioned. Denise and I will be kind of passing the baton back and forth during the course of our webinar today. So just be aware that you'll be hearing some different voices. But I'm going to start today by talking about what we're actually going to talk about today. First, we're going to talk about the power of wearable simulators. We're going to cite some research that's been completed about how effective the use of wearable simulators is. We will talk about quite a few different products that Realityworks has to offer that incorporate wearability into the products themselves. We'll then talk about some best practices for using wearable simulators and wrap up with some free resource presentations and an opportunity for question and answer session. Okay, so let's start with the power of wearable simulators. So a few years ago, research was completed by the University of Minnesota in partnership with us here at Realityworks and an organization called Innovative Design Labs based out of Minneapolis. Really, we were very interested about the efficacy of wearable simulators. The University of Minnesota published their research results in Clinical Simulation in Nursing in 2023. Their results basically showed that peer physical examination limits learning and therefore threatens psychological safety. So they wanted to start off by talking about the fact that doing just peer-to-peer practice with each other, it does have huge limitations. And they wanted to contrast that with how is that level of psychological safety when wearing a wearable. So the wearable simulator system, they found offers more realism while protecting student privacy. They also found that a standardized patient wearing a simulator was rated satisfactory by students and faculty participants. So we were really honored to be a part of that research study completed at the University of Minnesota. I will mention that when you receive the PowerPoint presentation in your email in the next 24 hours, you will get citations for the research that I'm citing. So if you're really interested in reading the entire report, you'll have the information you need to locate those articles. A 2022 article was published by Healthy Simulation on their blog, entitled Wearable Healthcare Simulators Lead to Better Prepared Learners. This article stresses the benefits of wearables in focusing the student not just on technical skills, but also on the absolutely necessary aspects of communication skills while performing the procedures. So they were really looking at, when you're on a static mannequin, that performing different procedures, students tend to get really focused on doing the procedure alone. And that with the use of a standardized patient using a wearable, that they're really forced in that situation to concentrate not only on their technical skill, but on the communication skills that are a vital part of patient care. There was a systematic review published in 2020 by Brown and Tortorella. They talk about the positive impact of communication skills, as well as wearables being a cost-effective alternative to high-fidelity simulators. They also mentioned that as a result of these experiences with standardized patients with wearables, the students felt better prepared to handle the real-life experiences of patient care that they would find after graduation. So now we're going to talk about some of the actual products that Realityworks has to offer that incorporate wearability. You can go ahead and forward. There you go. The first one we're going to talk about is the Geriatric Simulator. So this is composed of all the things that you see on the screen. It has a weighted vest. It has joint restrictors at the knees and elbows. It has ankle and wrist weights. It has a cervical collar, gloves that kind of interrupt the tactile information that people feel. It comes with a set of 6 different visual impairment glasses and a walker. Really handy carrying case for all of it. So this is a really robust product, and we've actually had unbeknownst to me, I went to a conference a couple of years ago, and someone had done a professional poster about their students using our product. So we're super excited to see how powerful this product has been out there in the real world. So the curriculum that comes with this product has 8 different lessons. You see them outlined there for you, and they all total 10 to 15 teaching hours that can be incorporated into your courses. So we have a video we can show you now.
Students love our geriatric simulator because they get to personally experience the physical and visual challenges many older adults face. By wearing the simulation suit, students feel firsthand limited mobility, such as stooped posture, restricted range of motion, and visual impairments. This experience naturally leads to classroom discussions on empathy towards older adults, patient care challenges, and so much more. The simulator comes with everything you see here, plus a walker and 15 hours of curriculum. Contact us today to bring geriatric simulation into your classroom.
All right, so we have a free activity that we put together for you that you can use on your own that kind of simulates some of the things that you can do it's adapted from our Geriatric Simulation Suit curriculum and our Arthritis simulator curriculum. Because some of you don't have the simulator, we have come up with an activity that you can adapt to kind of get some of the same effects using commonly found objects that you can use in your classroom. So you can explain what students will be feeling if it's like to have arthritic hands, and then you can get transparent tape or duct tape and tape fingers together. That kind of thing is really helpful. If tape isn't available, you could use rubber bands or hair ties, anything that will restrict the movement and kind of affect fine motor skills that simulate the stiffness due to arthritis. It can be a really powerful activity. Let's see. You can do different things with that taping, with that restrictive pieces in place. You can have them do things like try to cut something with a pair of scissors, try to write your name with a pen, try to open a pill bottle, or do a twist cap off that are child protective, drink from a glass, or pick up and count change. All these things when your joints are have stiffness or mobility issues can be really difficult for people to understand how difficult it is until they try it themselves. And another experience, no, you can go back, Denise. Another experience is that there can be a loss of sensation that's associated with aging. In our kit, we include gloves to kind of simulate that. The sense of touch also includes being aware of pain, temperature, pressure, vibration, and body position. So you can have reduced sensation in all those different ways. So they can put on any pair of gloves that might be available, thin disposable gloves, even winter gloves, and to try doing those same types of activities. Cut with a pair of scissors, write your name with a pen, open a pill bottle. All these things are very difficult when you have that loss of sensation in your hands. You could also fill the fingers of the gloves with unpopped popcorn kernels. That also dulls the finger's ability to feel it, to being able to feel effectively, excuse me. So you can perform all of these activities with these components added in to make a powerful classroom experience for students. All right, our next products I'm going to hand over to Denise to talk about.
One of our other favorite ones besides our geriatric suit that she just shared is our Geriatric Sensory Impairment Kit. And you can use this impairment kit. There's 3 different simulations that are wearable, but it really will help your students to understand those common sensory challenges faced by older adult patients and help you to develop those geriatric nursing skills. So this kit does include a hearing impairment simulator, the Geriatric Arthritis simulator, as well as a Geriatric Tremor simulator. And it was interesting when we put this one together a few years ago. It was a couple years after we had the Geri suit, and we asked teachers, what other simulations for aging adults would you like to see? And these 3 really rose to the top. So the hearing impairment simulator, you have things like tinnitus or hearing loss over time. With those arthritis simulator things, you put them on your hands. It's almost like an exoskeleton, and it makes it difficult and even somewhat painful to move your hands and do things like twist and grip and so forth. And then the tremor simulator, we use EMS technology on one arm. And when you put the patches on the arm and you turn the device to a certain setting, it will make that hand shake just like an essential tremor. So again, very impactful for your students to walk in the shoes of an individual with those different types of conditions. Now the curriculum for those, we have 4 lessons. There is 1 lesson featuring hearing loss, one on aging on bones and joints. We have one devoted specifically to the tremor in the elderly, and then we've got an immersive one which brings together the whole geriatric experience. But if you taught everything in that curriculum, it could vary from 7 to 13 hours, so it can be a very robust part of a unit on geriatric aging. Now, again, we'd like to share one of our videos here.
Help your students develop empathy and sensitivity toward the elderly with Realityworks Geriatric Sensory Impairment Kit. This one-of-a-kind 3-piece kit includes 3 wearable simulators: a hearing impairment simulator, a geriatric arthritis simulator, and a geriatric tremor simulator, plus comprehensive curriculum, presentation slides, activities, and assessments. The hearing impairment simulator enables the wearer to experience tinnitus, high-frequency hearing loss, general hearing loss, and dementia-related confusion. The Geriatric Arthritis Simulator includes a wearable for each hand that enables the wearer to experience moderate to severe arthritis. The Geriatric Tremor Simulator uses EMS technology to induce hand tremors. For your convenience, each piece comes with its own protective case and user guide. Help your students develop a better understanding of the challenges that elderly patients often face with the Geriatric Sensory Impairment Kit by Realityworks.
We're going to go on to one of our other things, and that's free activity from this curricula. And this one has to do with all the things that you see on the screen there, things that you'd commonly have, but it's adapted from our Tremor simulator curriculum. And because some of you may not have that simulator, we're going to show you how to adapt this to create that simulation experience. First of all, you're going to have a Tremor simulation experience handout that can be accessed at the link that we provided above. Gather the items that are on the list, and then what you can do is set up stations around the room with a writing station, pouring, drinking from a cup, sorting, and drawing. And then to simulate the tremor, you could simply have students shake their hand. And in the lesson, you'd be able to be sharing background information about things like Parkinson's disease and essential tremor. And then here are a few very short videos that we found that could also be used to augment that type of lesson. And they're all very short, but very good, easily able to be fit into a lesson on tremor. Now, the Hemiplegia simulator is another wearable simulator from Realityworks, and this is going to enable your students to experience paralysis on one side of the body, hemiplegia. And this will help them to gain an understanding of patients' or family members' disabilities due to stroke or other similar conditions. And it also does come with a curriculum that addresses the physical effects of hemiplegia, plus teaching tools like presentation slides and assessment and so forth. So what you see on the screen in front of you, that is what your students would wear to get that weakness or paralysis on one side of the body. Now, when looking at curriculum highlights, it's 1 to 2 hours, but they get a lesson all about the physical symptoms, treatment and prevention of hemiparesis. And then, of course, you've got one on patient-focused care. So 2 really dynamic lessons that can help along with the wearable there. Now, we do like to give a free activity relating to this type of thing. So you could use the following scenario that you see on the screen as an example of a patient who may have hemiplegia. Now, this will focus on bringing in some soft skill scenarios and instruction into your program as well. Students could pair up and they could discuss the key questions that you see on the screen in front of you. Or you could even turn that into a writing activity. In order to give some background information on stroke and hemiplegia, you could even share some of the information from the videos that we've suggested on the screen. And again, they're brief but very full of information, so can easily fit into a nice little mini lesson on this type of topic. Now, one of our newest wearables is our COPD and Mobility Challenges simulation. And it's a series of 2 different wearable simulation experiences that are going to allow your students to walk in the shoes of an individual with COPD or mobility issues. Now, the COPD simulation includes the following symptoms: shortness of breath, especially during physical activity, wheezing, chest tightness, and lack of energy. And then the mobility simulation is going to simulate difficulty ambulating and a shuffled, unsteady gait. Now, there's 2 COPD simulators and 4 mobility simulators for your classroom management. So that gives you the ability to have your students rotate through the experiences at a variety of stations so that they can all be doing it at the same time. And then we've tucked in a 3-lesson curriculum as well. And all of the lessons will integrate the use of the simulation experiences to make teaching hopefully very easy for you. And in addition, we have a geriatric soft skill scenario card deck in there, again, to integrate soft skill instruction into these lessons. We do have a digital workbook available to you, and it includes all of the student activities, so you can print at your discretion for whichever ones you would like your students to do. So we found that this can work really well as a standalone product for those simulation experiences, or you could even do it as an add-on experience to that geriatric simulation suit that Molly mentioned earlier. So here's the curriculum highlights. You've got 1 lesson all about respiratory illnesses, and that's where you get that COPD simulation experience. Then we've got a lesson devoted specifically to those mobility challenges with age. And then we end up with a 3rd lesson focused on soft skills when working with aging adults. So the activity we'd like to share here is adapted from the lessons in our COPD and mobility challenges curricula. And if you do not have access to our simulator, you can still experience a modified version of shortness of breath and fatigue. So first of all, we'd say share one of the short videos about COPD, and we found a few here that were about 4 minutes in length. Then you could use a straw and you could cut it down to approximately 2 inches. Have your students complete the tasks on the experience form above. So you could take this and show it on a document projector, but it's really eye-opening how just doing this step, breathing through a short straw, can make one short of breath and fatigued. One of our other brand new simulators we'd like to highlight today is our Dementia Simulation Experience. And this we've created to help students understand the effects of dementia and how a person with dementia can feel, and how to care for and communicate with individuals suffering from dementia-related conditions is just so very difficult. So this interactive kit has supplies for 20 to 30 students to participate in a dementia simulation simultaneously. So you'd have 10 students acting as the patient with the dementia condition, and then others role-playing caregivers or family members. And there are 10 scenarios in the kit. There are 6 lessons. Each lesson, 5 of the lessons focus specifically on different types of dementia. So you've got Alzheimer's, Lewy body, frontotemporal, vascular, and mixed. And then there are 2 simulation scenarios that go with each of those types of dementia. And when you immerse students in that simulation, and they're wearing the glasses, the gloves, and the audio track is created specifically, so it includes the ambient sounds that the individual would hear during that simulation scenario. So we've tried to build in a lot of sensory overload as well, but just a very unique and impactful experience for your students. Taking a look at the curricula from that product, again, we've got 6 lessons, anywhere from 5 to 10 hours of content, but you can see it begins with an intro to dementia, and then you get into each of those varied types of dementia. And the activity we'd like to share from this does come from the dementia curricula. And if you follow the steps above, you could use this to kick off a unit on dementia. So dividing your students into approximately 5 small groups. You could assign one of the questions from the pre-test to each group, have them go out, research the answer, call them back together, have them share the answer that they came up with. And then you've got the answer key here that you can share that with them. And it's just a really good icebreaker activity to kind of gauge what your students think that they already know about dementia. So here are a few other simulators to consider before I hand it back to Molly. That we'd like to mention. First of all, we've got an elder abuse training kit. And this unique kit addresses risk factors and things like how to identify and report abuse and how to prevent it if possible. But in it, there's a wearable skin condition models or moulage that create very realistic scenarios. And there's student workbooks and curricula, which really make it an in-depth experience teaching empathy and care. We have another product called our Geriatric Medication Management Simulation Kit. And this helps build empathy and understanding of what it's like for older adults to manage multiple medications, all while having some physical challenges as well. And then the third one here is our Geriatric Skin Condition Kit. Again, it's moulage, where you can put these types of wounds either on students to role play or even on a medical mannequin. And you can examine them in detail. They're very realistic, but very impactful. So now I'm going to hand it off to Molly, who's going to share some very best practices for using wearable simulations.
Thanks, Denise. Yeah, so let's talk best practices. How can you use these in your classroom? So our first tip is to encourage group interaction whenever possible. So when groups of students experience, for example, the Geriatric Simulation Suit together, the conversations that they have are amazing. They're so rich and complex. Students are able to compare how they feel when they're wearing the suit. They can engage with one another as they try to complete physical tasks, like tying their shoes or using a cell phone. But they can also talk about how, as a caregiver, how complicated it is to care for the geriatric population. And so they can give each other tips. Well, maybe I was dressed up as the patient and you were taking care of me. Maybe if you had done X, Y, or Z differently, it would have worked out better. So that collaboration is really a great source of deep discussion and better understanding of what our geriatric patients are going through. as they each get their turn practicing what it's like to feel that geriatric experience. The next best practice is to debrief. Take time to reflect after the activity. I know time is tight in classrooms, but making sure that you plan out your classroom activities so that you finish 10 or 15 minutes early and you have time for a debriefing discussion. It's always great to ask about the students' emotional responses. How did this go for you? How did it feel for you during this experience as either the geriatric person or as the caregiver? And again, you can extend the conversation to include specific things that you may have observed during the exercise as the instructor. John, tell me about your experience as the patient when trying to climb stairs. How will this experience affect your caregiving in your own practice? So give them an opportunity to envision how they might react in situations like this as the caregiver themselves. You can also take time to address any safety issues that arose during the activities. Were there potentially hazardous things that happened during the activities that you as the instructor would like to call out so that your students are aware of those things in the future and can help prevent bad things from happening to our geriatric patients? Best practice number 3 is to use the wearables in a scenario. Rather than being task-oriented and saying, put this on and go climb some stairs, set up a hospital room or a nursing home room right in your classroom. Have one student wear the geriatric suit and the other play the role of the nurse or the certified nursing assistant. In this scenario, the role of the nurse is even more meaningful as they help the patient perform physical tasks like sitting down, standing up, walking, laying down. They're beginning to understand the reality of working with elderly patients, from having patience with their patients and effective communication to providing that actual physical assistance. At the same time, the student wearing the simulator is experiencing the physical impacts of aging on the body. These are key skills for working with the elderly. And our last best practice is to set up stations to rotate through. So again, when you receive the PowerPoint presentation, you'll see that I've got this laid out in the notes section of the PowerPoint. But creating several small group geriatric experience stations in your classroom is really effective. They can spend 5 to 10 minutes on one station and then rotate through. One station could feature the complete geriatric simulation suit. Another station could feature the visual impairment glasses. Another could simulate hearing loss, and so on. You could even extend and have one of the stations do some sort of a research activity, or that could be homework or work that they need to do outside of class. Maybe they have to answer specific questions about aging, for example. But station 1 could be fully immersive. So they're have the full geriatric simulation suit and they're completing tasks like buttoning a shirt or picking up items off the floor. The second station could be visual impairment. It could be using the visual impairment glasses and having activities to do while wearing the glasses. A hearing impairment station could be the third. And at this station, students could use cotton balls or noise canceling headphones to feel what it's like to be hearing impaired. Station 4 could be an arthritis station. Students could practice writing and other daily activities while wearing gloves stuffed with the popped popcorn or taping the fingers together like we talked about before. Station 6 could be the Station 5 could be the mobility station. And at this station, students could practice using a walker or crutches or a cane to help understand what that feels like. And then, yes, Station 6, our research activity station, where they could be doing some sort of research about anything related to the aging process and things that are challenging for our elderly patients. So now I'll pass it back to Denise again.
All right, so now what? We have some free 3 resources that we would like to point out before we move on to our Q&A today. First of all, we have a geriatric implementation guide, and it's very helpful to help you envision how you could lay out your classroom and how you could integrate the use of some of the wearables that we shared today. We've also got many different career exploration lessons available at the links we're providing. We've got posters, infographics, and just a whole lot of things available online. So these are just some links that we're providing to get you started with some of the things you can find on our web pages. Now, I'm going to turn it back to Kelsey, who's been monitoring the chat. But before we get into the Q&A, we would urge you to go ahead and scan that QR code that will connect you to us and help you be able to refresh or even start a geriatric program.
Yes. So I have a couple questions here. So first off, if someone were to purchase these kits, do they receive the curriculum when they purchase those kits as well?
All of the lessons that we showed are tied to each of the different products that we highlighted today, and you get access to those via a link that you're provided upon purchase, and it comes usually as part of the product in the form of a quick start guide that has that link to the curricula.
Perfect. And then another question here, what visual impairments do the geriatric glasses simulate?
I can name
6 of them. I'll see if I can remember all 6 off the top of my head. There's macular degeneration, there's diabetic retinopathy, there are cataracts, there is glaucoma. I'm missing the other 2, Denise.
Yeah, retinitis pigmentosa.
Uh-huh.
And yeah, 5 out of 6, not bad.
And then another question is, what vision impairment do you show with the Dementia kit?
Oh, that's really a good question. It might be retinitis pigmentosa. I know it's one of the ones where most of the areas covered, not completely, but it's confusing, and it's meant to create that sort of confusion along with the audio tracks and the tactile sensation loss in the hands. But if you're very interested in that, if you go to the product page for that, it will give you more details on the features and the specs.
Perfect. Awesome. Well, it looks like there are no other questions at this time.
Great. Thanks so much for spending part of your days with us. We appreciate your time.
Thank you, everyone.